This is a very important technology that has advanced our medical care and bring a very high impact for our patient and our surgical skill and technology advancement. So as I mentioned, in Taiwan, we have adopted this technology 20 years ago. So that means that the technology has been there for almost 20 years now. So at that time, when it started, not many people can accept it, or some people may feel uh, skeptical about this and have some doubt whether this really can bring a benefit to patient. Of course, at that time, the technology is still very new and is still very primitive. And I can remember the old machine is even bigger than this one. So, and they are not so smooth and the articulation are still have many room to improve. But since the technology is there, we use that only for a few procedure. But now after the evolve of the machine throughout the year, become compact and the instrument are more refined, and so now we can use it in many surgical procedure. So I believe now it is a standard of care, and like we expect, this robotic system can help us to do more complex cases that we cannot do as a minimal invasive way. So it's really have changed the surgical and also the whole medical field. Yeah, I believe in the future it will continue evolve, and now in Taiwan we even have the latest technology, but we call it a single port robotic system that we can just one hole and we can do in a small space, we can do many surgical procedures. Yeah, I think this is very important. Of course, as I say, different country adopt this system differently, and maybe like we are have the 20 years experience now, and we also have newcomer. So I think we can share a lot of our experience. And like in Taiwan, my hospital, Chang Gung Memorial Hospital. We are the biggest hospital in Taiwan, and we have the training center. So throughout the year, we have collaborate with Regency and many hospitals around this region. So we can share experience. We can invite them to come to our hospital to have training and observe our surgery, and later on we can learn from each other as well. Even uh, using different systems? Good question, because after we adopt the robotic system, now we are working with many hospital, and even we have seen the use of this tele surgery. You know, with the robotic, there's already tested that the surgeon can be far away. Like you say, look at this machine. The surgical arm is on the surgical table, but the surgeon is away. The surgical console is sitting away from the table. So it means that we can do this in a remote way. So there's a lot of experience now, and we have seen doctors in China do robotic surgery in Indonesia and also across Atlantic, like Europe and American. So in the future, I think tele surgery will be also a big issue and big moment. And also machines, machine wise, this machine will become smaller and smaller, more compact, and then probably the instrument can be even smaller. So patient will feel less pain, less scar. And as I mentioned, now in Taiwan, we start to adopt the single port surgery. It means that now you have four port, right? You have four arm. So we put all the instrument together, just one hole, and it's like a machine that can keep going through and with different instrument come out from one spot. Yeah, this is a advancement of the technology, and so I believe there's no limitation with the AI now. With a lot of advancement in technology, I believe we can make surgical more easy and more accessible, and then a smaller wound can do bigger things. Yeah.